Hello and good day to everyone. I'm Dr. Freddy Gomez, and this is The Doctor is In. Over the next half hour, we hope to answer your medical questions while you're staying safe at home. As we enter the third month of community quarantine, we continue to adapt to the challenges that come with the new normal. Isa na rito ang pag-commute ngayong GCQ. At syempre, nandyan ang mga challenges ng mga kababayan natin na nakaka-work from home pa rin. It's not uncommon to experience headaches as a result of adjusting to this new normal. So, in today's episode, we take a closer look at some types of headaches and the symptoms you should be aware of. So, joining me in today's episode is Dr. Alejandro Diaz. He is the section chief of neurology at the University of Santo Tomas Hospital. Welcome to the show, Dr. Diaz.
Hi, Dr. Freddy. How are you?
Glad you could glad you could join us, Dr. Diaz. Now, Dr. Diaz, as we know, no, there are many types of headaches that can afflict a person. What are the more common ones?
Yeah, I usually teach the topic of headaches and migraines. And I think the ones that usually come to us for consultation are usually migraine headaches. The more common one actually is the tension type headaches, but they don't usually come to us for consultation. It's because they can carry on with their usual work. They usually go on with their life, and there is no need for them to be disabled. Unlike
I think yes, that's a good point you made. You know, we will be talking more about migraine specifically about that and what to do later on in the show. But for now, I like what you mentioned of tension type headaches. What are some of the more common triggers that may cause tension type headaches?
Yeah, it's very common, especially in our COVID times. A lot of people got stressed actually, so that they commonly during the ECQ complain of mild headaches that are usually bilateral. It may be felt in the at the back of the head. We call it occipital part. It may be felt in the frontal part. Okay. Usually it's not throbbing. It's not pulsating. Hindi yung tumitibok, ni pumipintig. It's just a continuous headache. But as I said, they usually are able to just go on with their work. And as I said, it may be triggered by stress, sometimes overwork, or sometimes overindulgence in the gadgets, especially when they cannot do anything. They just watch Netflix and all of those. So if a person is prone to develop tension type headache, and then that's the usually thing that they feel. But usually it's not a very disabling one.
So ito yung mga klaseng headaches na pangkaraniwan lang nararamdaman, medyo magpapahinga lang ng konti, mawawala na siya kagad, ano? And like what you said, caused by a lot of things, especially now during GCQ, high stress
Right.
tayo. Now,
Right.
sinabi nyo na fairly common naman ito, especially now na many are a lot of people, no, are a lot are under
Right.
stress, anxiety. But can these types of headaches, can headache be one of the symptoms ng COVID-19?
Okay. What I mentioned earlier were primary headaches. So the more common primary headaches are migraine and tension type headaches. Occasionally, we do see cluster headaches. Okay, so the other ones are not so common. You know, the paroxysmal hemicrania, you know, those headaches, the stabbing, these are all belonging to the primary headaches. On the other side, there's what we call secondary headaches. When we say secondary headaches, they are usually secondary to a condition.
Okay, so if it's a condition, can COVID-19 be that condition na pwede maging simptomas ay headache?
Yes, okay. There was a study in Oxford University, those that were not usually hospitalized, because the ones that are usually hospitalized were the ones that were manifesting with respiratory signs and symptoms. But when they used the COVID symptom tracker, they were surprised that one of the more common symptoms that they were able to gather were headaches, okay? Headaches and dizziness. Uh, but of course, when we see these cases that usually last 2 months, I was very active in telemedicine, and a lot of them have consulted me with regards to this. And I usually ask them, uh, did you have migraine in the past? Is this the first time that you had it? Because if this is had been there and just aggravated, but it may be a stress recurrence of migraine attack. But if you did not have any headache in the past, especially when it is associated with other symptoms like fatigue, okay, fever, other systemic infection, something that's unusual. Sometimes that it sticks on, doesn't go away. Then that's the time that I usually ask them to get tested because, as you know, in the Philippines, headache,
Okay.
anosmia, yung loss of those are not, they don't belong to the usual criteria that get tested because of our limited resources. In other countries,
Right.
if you are if you have atypical symptoms, not characteristic of migraine, not characteristic of tension type headache, and you have other symptoms, okay, like fatigue, tiredness, and headache. Okay, I think those are
Yes.
symptoms that can be eligible for testing. Of course, on the other side,
Okay,
since I'm
that's
a
very well. At
neuropsychiatrist,
least
Freddy,
naliwanagan na po kami dyan,
uh,
Doctor.
and also Freddy, because I'm a
Yes. So before we
neuropsychiatrist,
continue our discussion, yes,
right?
before we continue our discussion, Doctor, let's answer some of the social media questions that were posted online. Ang unang tanong natin is from Chelly. At what point should I consult a doctor about my headache?
Okay. I think it's very important for a patient or a person with headache if he can find a way to teleconsult with his doctor or her doctor. It's the best way because we do not advise a patient with not the emergency type of headache. Like, for example, if your headache is associated with very severe headache, impairment in consciousness, fever, okay, there are other concomitant, and then you go to the emergency room. If you have a sudden severe headache with loss of consciousness, it may be secondary to a ruptured aneurysm, then go to the emergency room. But if it is something that you have a stable headaches, pounding headaches, with nausea and vomiting in the past 6 months. And then this COVID time, it became aggravated. You have more headaches. It's just that an aggravation of the migraine headaches. And usually, I actually prescribe them with, I do check their migraine medications, or if the first time, then I introduce them to anti-migraine medication. And very important is the talk therapy. As I get because a lot of
Okay,
these migraines are really triggered by stress and anxiety.
right. So we'll be talking about migraines a little bit more later, no? But first, meron pa tayo isang tanong from Aiden. Ang tanong niya ay, when already experiencing, do we need to take painkillers right away? Magandang tanong yan.
Okay, when experiencing a headache, do we need to take well, it depends upon the proper context. If you are a migraineur, okay, and you have had migraines in the past, okay, and you're sure that you're going to develop from, usually migraine is like this, it goes to a pain scale. 1 is the mildest, 10 is the most severe. Hindi naman agad yan na 10 kagad eh. So they go to 1, 2, it develops. So I advise my patient to take prophylactic medication so that it will not become severe. Now, if it is in the around of range of 4 or 5, that's moderate headache, then I ask them to take medication already so that they will not go into the severe ones, the severe intensity of 10. Most of the time, unless they vomit, they don't get relief with their headaches. And I usually give them prophylactic medication. These are not pain medicine, but they take it regularly, okay, to help reduce the sensitization in the brain that causes the recurrence of headache.
Okay, very good. Now we have to pause for a quick break, but when we return, we'll discuss the difference between a headache and a migraine. Stay tuned, we'll be right back. Welcome to The Doctor's In. I'm Dr. Freddy Gomez. We want to make the most out of your telemedicine appointment today, so please send in your questions and we'll do our best to answer them. Thank you very much for joining us. Now, not all headaches are made and felt the same way. Migraines, in particular, can interfere with a person's productivity, and at times it can even be debilitating. We are with Dr. Alejandro Diaz at the UST Hospital, and, he is here to give us the facts about migraines. Dr. Diaz, oftentimes people think a migraine is a really bad headache. Is that all there is to a migraine?
Yes, yes. As I said earlier, there are the two common primary headaches. The more common ones actually are the tension type headache, but they don't usually consult us. Dinadala lang nila. But the migraine headaches, it's really disabling, especially when they get, they start absenting themselves. No, they cannot go to work. It reduces their productivity. Okay, so we have a scale. We call it the Midas scale. So they can actually just download it or Google it, the MIDAS. It's a questionnaire that's, the Midas scale. And then you can more or less grade the severity of the headache. And this is the one that can more or less give us a feedback whether how severe or bad is the or disabling is the headache. And then I have a three test questions that I usually ask the patient. Okay, is it pounding? Pumipintig ba? Okay, is it does it interrupt their usually work? Okay, is there photophobia? Nasisilaw sila or phonophobia? Do they get nauseated? So if they have this, the PIN na sinasabi namin, then till proven otherwise, that is migraine. Some cases of migraine may not necessarily present as the classic one. In the beginning, it's almost like the tension type headache. Okay, sometimes they present to us with neck pain. Neck pain. Sometimes they go to the ENT, akala na sinusitis, because a migraine can affect also the frontal part of the face. Okay. So very important is the history. And of course, there's what we call we usually test for could this be a part of the secondary headache. So we follow this SNOOP. Okay, S stands for systemic. Does the patient have cancer, malignancy? In which case, we might have to think of baka meron itong metastasis to the brain. Does the patient have fever? Is there an infection, a viral encephalitis, or a meningitis, like that? And in COVID era, headache is also one of the manifestations because although not very common, but we now know that the SARS-CoV-2 virus can actually, okay, traverse also hematologically to the brain, to the cerebrospinal fluid, causing encephalitis, or it can actually travel retrograde. That's why they can manifest with headache and some other manifestations like disorientation, delirium, okay, agitation. When we have that, then we suspect that the patient
Okay.
may not just have an ordinary headache. Another one would be also we look at the is it postural? Okay, is it associated with coughing? When
So,
it becomes more
sorry, doctor,
severe.
to interrupt you. I don't want to interrupt you on the menu, but because of time constraints, can we go to the possible treatments for migraine? Because I know there's a lot, maraming kang na-mention na possible causes
Correct.
for migraines, how severe this is. So this is a very serious disease.
Okay.
What kind of
Okay.
treatments can you offer with someone who is affected
First,
with migraine?
first is lifestyle modification. During COVID times, a lot because of the stress, they would increase their drinking of alcohol, okay, especially red wine. We try to advise them to avoid drinking wine because it can trigger headaches. Okay, chocolates also, no, because of stress they overeat chocolates. It can also trigger to, uh, I advise them to do regular exercise, especially very important to expose themselves to the sun because the vitamin D status, it makes you healthier. You feel better. Your immune system gets better, so you feel great. So that you don't feel much stress. The important is if you are working from home to set boundaries because there's a tendency that you don't decipher the boundaries. You work and eat and all the time, and before you know it, you develop already triggers of migraine headaches. And of course, we sometimes prescribe them with medications that can stop the sudden severe headaches, and of course, some medications to be taken as a prophylactic medication. And if the patient is depressed or have anxiety, we have to treat them also with psychosocial approach, okay, talk therapy, behavioral approach, and some medication. If needed be, we'll have to give them some antidepressants if they're depressed. And depression may not always manifest with sadness or loneliness. Very common are physical symptoms of depression, and one of the more common ones are headaches.
Okay, so there was a lot. Just to summarize for our viewers, in order to determine whether your headache is indeed a migraine or not, the following symptoms that Dr. Alejandro mentioned, plus the fact that you will know for yourself whether ito na ay seryoso na if this affects your daily productivity, if this affects your lifestyle, then it is
And yeah, and
very
I almost
prudent for you na magpa-check sa doktor, ay ideally online. And then, yes,
Freddy,
doctor.
okay. It's also very important that we
Yes.
as neurologists, okay, we can do neurologic examination, okay, neurologic examination in telehealth, in telemedicine. So it doesn't have to be physically face-to-face examination. Okay, so the doctor should know how to evaluate a patient, ask the right question, because 85% of the time, if you get a very good history, you'll be able to get the right diagnosis. I don't believe that, a lot of patients, even before COVID time, they always ask me, doctor, would you not like to request for an MRI or a CT scan? And I will tell them no, because I'm sure you have migraine, you don't need that, okay? It's just,
Right.
added
That's right.
expense to you.
That's right.
Okay, right.
Yeah. So that's very true. Thank you very much, Dr. Alejandro Diaz from St. Luke's Medical Center, for
Sure,
sharing with us your knowledge when it comes to migraines.
sure. Thank you very much,
When we
Freddie.
return, headaches caused by possible vision problems is what we will be going to is what we will be discussing. So please stay tuned. You'll definitely want to know about that. Welcome to the Doctor's Inn. I'm Dr. Freddy Gomez. Eye problems can be a possible cause for headache, especially now that we spend more time glued to our gadgets for work or leisure. We're joined today by Dr. Edgar Leuenberger. He practices ophthalmology at the Asian Eye Institute and is the president of the Ophthalmological Foundation of the Philippines. Welcome to the show, Doc Egay.
Hi, Dr. Freddy. Good afternoon. Magandang hapon sa lahat ng tagapakinig natin. Sana okay lahat tayo.
Now, yes. Now, Doc Egay, kapag ang headache ay dulot ng posibleng problema ng mata, ano ang mga simptomas na mararamdaman ng pasyente?
Unang-una, headache, hindi normal ang headache. Kadalasan, umiiwas muna yung mga pasyente sa mga ospital at mga serious na mga karamdaman at iniisip nila minor problem lang. So pumupunta muna sila sa optical, isipin nila na baka salamin lang because it's very harmless to think na sa mata lang siya. Tapos kung hindi makuha sa optical, pumupunta sa mga ophthalmology clinic, no? So, ang nararamdaman nila, gaya nung pinag-usapan nung ni Dr. Diaz na neurologist guest natin kanina, of course, headache at kadalasan tension headache. At pag-usapan na natin yung pagkakaiba ng tension headache and migraine. Yung sa mata naman, isa sa mga causes ng headache yan, no? So, madalas actually yan sa dami ng gadgets na ginagamit natin, pati mga activities na ginagawa natin. Kung minsan, hanggang sawa talaga yung ating Netflix, hanggang sawa ang ating Facebook. So, hindi mahirap isipin na magkakaroon ng eye strain, fatigue, at malulubat talaga yung mata natin sa dami ng ginagawa.
So, in terms of eye strain na na-mention niyo, Doctor, ito yung pinaka-cause ng ating headache pagdating sa mga problema ng mata. Makaka-influensya ba yung certain conditions na meron isang tao with regards to their eyes, tulad ng may mga tao na nearsighted, farsighted. There are some people who even have astigmatism. Could you talk a little about this, because a lot of people may still be unaware of what these conditions are?
Yes, yung tinatawag natin, yung tatlong sinabi nyo, ang tawag natin dyan, error of refraction. Ibig sabihin may grado sa mata. No? Ngayon, kung ang tao ay nasa bundok naman, ay farmer, alam nyo kahit may error of refraction dahil malalaki naman yung tinitingnan niya, mga kalabaw, mga puno, hindi na masyadong magkakaroon ng problem. Pero oras na binigyan mo ng gadget yan, doon nagsisimula lahat. Kasi kailangan niya tingnan yung mga detalye ng kanyang mga gadget at lahat ng magtataya siya sa loto, kailangan maliliit yung mga detalye, titingnan niya. So kung nasa edad siya na tinatawag na presbyopic age, na 40 anyos at kailangan na magsalamin, mahihirapan talaga siyang tignan yung maliliit na detalye. Ang kadalasan yan, nakikita natin, nilalayo natin sa mata natin yung bagay. Hanggat mauubusan tayo ng haba ng kamay. So pagka hindi na kaya, yun, pinipilit pa rin natin at may period of denial. Sa lalaki medyo matagal, sa babae medyo maiksi yung period of denial. So pumupunta kaagad sila sa optical dahil hindi nila kayang tagalan yung dati nilang ginagawa at ang number one suspicion nila mukhang galing ito sa mata. No? Dr. Freddy, yung kadalasan na typical characteristic ng problema ng headache na galing sa mata, paggising mo, wala pa yan. No? Tapos kung simula ka na sa trabaho mo, computer, sa dami mong ginagawa, kadalasan mga 11 o'clock or 12 o'clock, assuming na normal yung waking hours mo. 12 o'clock, 1 o'clock, doon mo na mararamdaman. Medyo mabigat na dito, mabigat sa batok, at yung productivity mo bumababa. So, importante ito sa mga kumpanya. No? Dapat malinaw ang mata, tama yung grado. So, yung tinatawag natin na nearsightedness, ibig sabihin, mas malinaw yung paningin pag inilapit natin sa mata natin yung mga bagay. Yung farsightedness naman, yung paningin natin mas malinaw pag nilalayo natin yung mga bagay. Yung astigmatism, kahit malayo, malapit, malabo yan. Sila yung sumisingkit yung mata pag tumitingin ng mga bagay na gusto niya makitang luminaw yan, sumisingkit yung mata nila. So pagka hindi mo nilagyan ng salamin yan, doble ang trabaho ng mata. At eventually, dahil meron tayong maliliit na mga pyesa, yung tinatawag natin na eye muscles, na pupuwersa ng husto yan at nagkakaroon ng headache yung isang pasyente. No? So, yun yung influence, yun yung epekto ng mga grado sa mata. Of course, depende sa age, kinukunan namin ng history yan. At yung problema sa mata, madaling solusyonan. Ibig sabihin, eye strain, salamin lang yan, o contact lens, kuminsan laser, pahinga lang yung mata, get enough sleep, and eye rest, very important, and tama dapat yung grado. No? So, Dr. Freddy, pag yung pasyente pumupunta sa amin na may sakit na headache, sinasabi namin, unang-una, hindi normal ang headache. Ang simptomas na headache, hindi normal at hindi dapat baliwalain. 5 doktor ang nakikialam dyan pag may headache. No? From pinaka-mild to pinaka-severe. Pag hindi namin tingin namin hindi galing sa mata, ang unang-unang nire-referan namin, ENT specialist, pwedeng sinusitis.
Okay.
Pangalawa, cardiologist. Baka masyadong mataas na yung BP nila, yung headache nila dahil sa mataas na BP. Pangatlo, yung tinatawag na neurologist.
Okay.
No? Yung neurologist, kuminsan hindi na sila umaabot doon dahil pag sinabi ko kailangan nang pumunta sila sa neurologist, bigla silang gumagaling dahil natatakot na sila sa mga MRI, sa mga CT scan, mga serious diagnosis. So sinasabi namin, huwag kayong matakot dahil yan ay early detection. No? So yung pang-apat, of course, eye specialist kasama kami doon. Yung pang-5, pwedeng spine specialist. Pwede kasi meron tayong mga tinatawag na naiipit na mga nerves sa ugat. Mali ang posisyon ng pagtulog at matagal tayong nakayuko. Imagine 10 kilos yung ating ulo. Kung palagi tayong nakatungo, 10 kilos yan na binubuhat ng leeg. So after a certain age, kaya pa yan. Pero after 40, 45, pagdating ng menopause, marami nang naiipit dyan sa mga ugat that will cause headache. Tapos meron pa tayong pang-anim kung hindi talaga makuha ng ibang mga doktor, pwedeng dental din yan, no? Yung mga jaw, yung mga ipin, misaligned. So sa dami ng pwede mangyari dahil mapanin lang ang headache, mapagpanggap, no? So hindi siya kaagad-agad na tutuko yung
Marami
diagnosis dahil sa
talaga.
head.
I agree.
Yeah.
I agree with that. So marami talagang pwedeng pagkuhanan ng headaches. But for now, I think we have time for one social media question. Let's
Yes.
answer this one from Joanne. Gumagana po ba ang blue light glasses to lessen eye strain? Ano sa tingin niyo, Doctor?
Actually, Joanna, ganito yan, no? Ang tingin ko lang dyan, no offense to the businessman, pero ang tingin ko parang marketing lang kasi yan, no? The reason kung bakit talaga kayo nag-eye strain ay overuse, no? Ibig sabihin, sinobrahan nyo. Kumbaga sa telepono, hindi na kaya nung mata ninyo, wala ng baterya, pinipilit nyo pa rin. So, hindi dapat solusyon ang filter ng blue light dahil actually may engganyo pa kayong gamitin ang husto yung mata ninyo kung suot kayo ng ganyan. No? So ang solution dyan is to rest your eyes every 20 minutes, rest it for 20 seconds, and you can be more productive. And eye rest at huwag yung hanggang sawa yung paggamit ng gadget. Kung minsan ginagamit pa nila yung gadget pampatulog, actually hindi maganda yun. No? Dahil pag napuyat kayo, tataas ang BP ninyo, mapupwersa kayo, magkaka-tension headache kayo. So sunod-sunod na yan. So
Doctor,
sa tingin ko,
sorry, Doctor, I don't mean to cut you off, but because we have,
no problem.
I think what you're saying is important, and the advice you're giving is very important. Could you summarize for our viewers, because what I think you're saying is very important.
Yeah, so sa panahon ngayon ng lockdown, no, bawas-bawasan natin yung pagtitig sa mga maliliit na bagay na malapit. Yung eye rest, very important. At huwag nyo ipagpawalang bahala yung headache. Pag safe na lumabas, kailangan yung sinabi ni Dr. Diaz, no? Unang-una, telemedicine dahil hindi normal ang sintomas ng headache. Pangalawa, yung telemedicine available sa private clinics. Kung sa Asian Eye, you can call 8898-2020. Kung naman naghihirap at kailangan ng tulong pinansyal at gusto nyong libre, dun sa Ophthalmological Foundation of the Philippines Facebook page, you can go to OFPHIL and our patient officers will take good care of you. No? So yun lang, take good care of your eye dahil pagkatapos ng lockdown, kailangan natin yung mata natin para magtrabaho ulit.
Right. Thank you very much, Doctor, for sharing your expertise on this topic. At sana'y nasagot namin ang inyong mga katanungan. Samahan niyo kami muli bukas, 3:30 p.m. on The Doctor is In. I'm Dr. Freddy Gomez. Stay safe, everyone.